Hello and welcome. Today we're diving deep into a common yet often misunderstood digestive condition, irritable bowel syndrome, or IBS. We'll explore what IBS is, what might cause it, how it affects the body, and most importantly, how it's managed. If you or someone you know struggles with abdominal discomfort, bloating, or changes in bowel habits, this video is for you. Pinpointing the exact cause of IBS remains a challenge, and experts believe it's likely a combination of factors at play. These factors can include abnormal muscle contractions in the intestines, which can be either too strong or too weak, leading to diarrhea or constipation. A sensitive or overactive nervous system in the gut can also play a role, causing pain and discomfort even with normal amounts of gas or stool. Some people develop IBS after a severe infection, like gastroenteritis, and this is known as post-infectious IBS. Furthermore, changes in the gut microbiome, the complex community of bacteria, viruses, and fungi residing in your intestines, can disrupt the digestive process. Psychological factors like stress, anxiety, and depression are also strongly linked to IBS symptoms, although they don't directly cause the condition. The pathophysiology of IBS is complex and multifaceted. Visceral hypersensitivity is a key component, meaning that the nerves in the gut are extra sensitive to stimuli like stretching or gas. This heightened sensitivity amplifies pain signals sent to the brain. Abnormal gut motility, referring to the way the intestines contract and move food along, is another crucial factor. These contractions can be erratic, leading to either rapid transit and diarrhea or slowed transit and constipation. Inflammation, even at a low-grade level, may also be present in the gut lining, contributing to symptoms. Changes in gut permeability, sometimes called leaky gut, can allow substances to pass through the intestinal wall more easily, triggering immune responses and inflammation. Finally, altered brain-gut interaction, where the communication between the brain and the gut is disrupted, can exacerbate symptoms by affecting motility, sensitivity, and immune function. IBS is a very common condition, affecting an estimated 15% of adults worldwide. Women are more likely to be diagnosed with IBS than men. While IBS can occur at any age, it's most frequently diagnosed in people between their late teens and early 40s. It is a global condition, affecting individuals in all countries and ethnicities. Although the prevalence is similar across many regions, access to diagnosis and treatment can vary significantly, leading to underdiagnosis in some areas. The signs and symptoms of IBS can vary widely from person to person, and their intensity can fluctuate over time. The most common symptoms include abdominal pain, cramping, or discomfort, often relieved by bowel movements. Changes in bowel habits are another hallmark, with some people experiencing diarrhea, others constipation, or a combination of both. Bloating and excessive gas are also frequent complaints. Other symptoms may include urgency, the feeling of needing to have a bowel movement right away, and incomplete evacuation, the sensation that you haven't fully emptied your bowels after a bowel movement. These symptoms can significantly impact quality of life, leading to missed work or school, social limitations, and emotional distress. Diagnosing IBS can be challenging because there's no single test to confirm it. Diagnosis relies primarily on a careful assessment of your medical history, a thorough physical examination, and a description of your symptoms. Doctors use the Rome criteria, a standardized set of diagnostic criteria to help identify IBS. These criteria focus on the presence of recurrent abdominal pain or discomfort associated with changes in bowel habits. To rule out other conditions that could be causing your symptoms, your doctor may order blood tests, stool tests, or a colonoscopy. These tests help to exclude conditions like inflammatory bowel disease, celiac disease, or infections. IBS is often categorized into subtypes based on the predominant bowel habit. IBS with constipation, or IBS-C, is characterized by hard or lumpy stools and infrequent bowel movements. IBS with diarrhea, or IBS-D, involves loose or watery stools and frequent bowel movements. IBS with mixed bowel habits, or IBS-M, features both constipation and diarrhea alternating between the two. There's also a subtype called IBS-U, or unsubtyped IBS, which is diagnosed when the bowel habits don't fit neatly into the other categories. While there's no cure for IBS, there are many effective strategies to manage symptoms and improve quality of life. Dietary modifications are often the first line of defense. This may involve following a low-FODMAP diet, which restricts certain types of carbohydrates that can be poorly absorbed in the gut. Increasing fiber intake, avoiding trigger foods like caffeine or alcohol, and drinking plenty of water can also be helpful. Medications may be prescribed to address specific symptoms, such as antispasmodics to reduce abdominal cramping, laxatives to relieve constipation, or anti-diarrheal medications to control diarrhea. Probiotics, which are beneficial bacteria, may help to restore a healthy gut microbiome. Managing stress is also crucial, and techniques like mindfulness, yoga, or cognitive behavioral therapy can be beneficial. In some cases, antidepressants may be prescribed to help manage pain and anxiety associated with IBS. While there's no guaranteed way to prevent IBS, there are steps you can take to reduce your risk and manage your symptoms. Maintaining a healthy lifestyle, including a balanced diet, regular exercise, and adequate sleep, can support overall gut health. Managing stress through relaxation techniques or therapy can help to prevent symptom flare-ups. Identifying and avoiding your personal trigger foods can also be beneficial. If you've experienced a gastrointestinal infection, prompt treatment may help to prevent the development of post-infectious IBS. IBS is a chronic condition, meaning it can last for a long time. However, it's important to remember that it's not a progressive disease, and it doesn't lead to more serious conditions like cancer. With proper management, most people with IBS can lead full and productive lives. Current research is focused on understanding the underlying mechanisms of IBS, including the role of the gut microbiome, the nervous system, and the immune system. New treatments are being developed to target these mechanisms, such as fecal microbiota transplantation, which involves transferring stool from a healthy donor to restore a balanced gut microbiome. Researchers are also exploring new medications that target specific receptors in the gut to reduce pain and inflammation. The future of IBS treatment looks promising, with the potential for more personalized and effective therapies.